and we still have 5,427 AstraZeneca appointments and 8,174 first dose Pfizer appointments available right now over the coming days. So please get on board this real momentum that the Victorian community are a part of. If you have yet to get yourself vaccinated, now is the perfect time to make your booking. Just an update on the VCE Blitz, which is now coming to the back end of its processes. You'll recall that that's been going for a while. Tomorrow is the last day of that VCE Blitz, with priority bookings for years 12 and 11 students undertaking their 3-4 subjects. We've had a very strong turnout from the VCE group and the Year 11s who are also doing the 3-4 subjects, with more than 21,232 students, their teachers and exam supervisors booking through that system. We know that as part of the now more than 100,000 16 to 18-year-olds who have booked, who have been vaccinated across the state in that same period of time, that arrangements with GPs, arrangements that schools have made directly with primary care providers, that we've seen a huge amount of those eligible groups of both VCE students, their teachers and their exam supervisors take those important steps to make sure that they have this ring of protection so that their return to both the GAT and the VCE exams can continue. There is still one day to go for that hotline and that blitz, so please, if you've yet to do so, get the hotline number from your school and make an appointment now. There's one day to go. In regards to some of the pop-up clinics, particularly in the north, which continues to be, as Kate will share, continues to be the centre, one of the hotspots of the outbreak. Further vaccination centre pop-ups will be established in the 100 most required postcodes that need the biggest effort for the vaccine push and are dealing with the largest number of cases. There will be another pop-up started at the C.B. Smith Reserve in Fawkner. It will support two immediate neighbouring schools, one being the Durrell Ullum College of Victoria and the other being the John Fawkner Secondary College. This pop-up will run from Monday the 27th of September to Wednesday the 29th. Students, families, staff, anyone in that local community is more than welcome to attend, and it will be just a walk-up site, no bookings required. Information will go out through communities, through social networks, through all sorts of platforms to get people engaged in that particular pop-up, and there will be many, many more, and there are many more across the north, the west and particularly the southeast. As previously announced, the pop-up at Mount Ridley, Peter 12 College in Craigieburn has also opened today from 10:30. Again, please, if you're in that Craigieburn area, come along. Craigieburn is also quite a centre of the outbreak at the moment, and we need the community who is yet to get vaccinated to come forward and take this opportunity. The number of school-based pop-ups, as we indicated when we announced the 100 postcodes of concern last week, is continuing to increase, and we are continuing to build on those 70 sites of those pop-ups right across those areas of concern. I'll hand over to Kate for a bit of a map of where the outbreak is up to, and then we're happy to take questions.
Thank you, Minister, and good afternoon. We now have, in yesterday's numbers, we have 295 cases in the northern suburbs, which is 55%, and 62 of those in Craigieburn. As the Minister just mentioned, Craigieburn is one of the most serious situations in terms of case numbers. It is, yet from yesterday's numbers, more than double the next suburb, being Roxburgh Park of 28 cases. Meadow Heights, 25 cases. We now have over 2,500 active cases in those northern suburbs. So please, again, as the Minister said, we're establishing pop-ups in that area for vaccination. Of course, state hubs, pharmacies, clinics, they're all available. Please come forward and get that jab so that we can try and drive the case numbers down in Craigieburn. And as always, a reminder, please, if you're getting symptoms, come forward, get tested, and please try your best to minimise your movement. In the western suburbs, 183 cases in yesterday's numbers, being 34%, and the largest numbers of cases in Hoppers Crossing, where there were 16, and Truganina, where there were 11. Over 2,000 active cases in our western suburbs at the moment, or approximately 41%. In the south and eastern suburbs, 38 cases yesterday, 7%, including 5 in Dandenong and 3 in Pakenham. 334 active cases in the southeastern suburbs, which is approximately 7% in total. In the regions, we are still seeing increasing case numbers and we are concerned by it. In yesterday's numbers, 15 cases were in regional Victoria, and I'll go through those now. 2 new cases in Ballarat, however, they were household contacts of previously known cases. We now have 11 active cases across 3 households and over 20 exposure sites in Ballarat, with more being added throughout the day. So please, Ballarat citizens, if you can keep checking the website. And again, it's been an amazing response from the Ballarat community, and I'd like to add to the Minister's thanks for everyone in coming forward and getting tested. Having tested 5% of the population in 2 days is a truly magnificent effort and a great way to try and return some freedoms to the City of Ballarat as soon as possible. There are now a total of 8 testing sites in Ballarat. We did have 1 case drop in Moorabool Shire, but it's late last night, so I don't have any detail on it. It may be related to the Ballarat exposures or it may be different, but further information will be available on that throughout the day. We have 4 new cases in Geelong, these cases are concerning to us. We don't have clear sources of acquisition for these cases, although there are links to Melbourne and links to construction in a couple of those cases, so there may be possibilities for acquisition there. 5 new cases in Mitchell Shire, all of whom have work links back to Melbourne. So again, we're seeing that cross movement between the peri-urban areas of Melbourne or, the open construction industry, as previously mentioned, hence the restrictions changes that have been recently introduced regarding the crossing of workers between metropolitan Melbourne and regional Victoria. Those cases in Mitchell Shire live in Broadford, Kilmore and Wallen. In the Macedon Ranges, we have 2 new cases, one of whom dropped late last night, and I don't have any details as yet, and another one living in Gisborne, again with work links to Melbourne. We have 1 case who is resident in Bass Coast, but acquired their infection through a construction site up in Canny, which is near Swan Hill. That construction site now has 3 active cases linked to it. In Wodonga and the northeast, no new cases to report, but there were 2 confirmed cases in Albury. So please, Wodonga residents, minimise your movement across the border as much as possible. Where you can seek your supplies and groceries on this side of the border, we do encourage you to do so. We'd like to keep Wodonga as safe as possible. We continue to have new and unexpected detects in our wastewater testing system in regional Victoria, including a repeat unexpected detection in Moe and Trafalgar, and a confirmed repeat detection in Aries Inlet. So again, a reminder that COVID, this insidious virus, does move really easily from person to person, and if you're in regional Victoria, the risk is there. Please get tested if you're experiencing symptoms. With respect to a couple of sites of interest that have been reported on this week, no new cases in the Campbellfield factory and no new cases at V-Line. So there are still 7 active cases from that V-Line outbreak. In coming days, we will be adapting our processes further in terms of how we contact trace to make sure that we manage the highest risk. We've already started sending some text messages to confirmed cases to warn you that we will be calling you and following up soon to check on your wellbeing and make sure that you haven't been working, for instance, in places of high risk, such as food distribution, aged care, and so on. We do expect, as case numbers rise throughout this week, that we'll be changing and adapting those processes further. We do expect later this week to be sending text messages to all confirmed cases so that we get that advice to you as soon as possible. We will also be moving to make phone calls first based on risk. So there may be some delays later this week in the time between you receiving a text message and you getting that call. The text message does contain information around what to do if you're unwell. Please, if you're not feeling well, call us, call your GP, seek help. We can't support you if we don't know you're unwell. As always, 000 is there for urgent cases. Those text messages will also include information on how to get more information if you need relief support, food, medications, assistance with groceries to your house and that kind of thing. And also a reminder, please keep isolating, and those with you in your household will also need to quarantine. As I say, we are always making adaptations to our processes based on risk and to make sure that we try and manage the greatest public health risk first. We will always be calling you as a positive case to manage and support you throughout your isolation period because your health and wellbeing is really important to us. And again, if you at all feel unwell, please do reach out either to the department or your GP or in urgent cases to 000. We're all aware of some tragic incidences this week of people passing away at home. And in those cases, we weren't aware that they were confirmed cases, but please, it is a tragic circumstance and reach out. Again, get tested if you're feeling unwell. This can be a really difficult time for confirmed cases and we're aware of it, and we are here to support you and manage you through the process. I'll pass back to the Minister for questions.
Thank you, Kate. Any questions?
Well, Minister, with 535 and only 62 linked, is that an indication that our contact tracers have now been swamped and we've hit the mark where, as Kate pointed out, we're going to have delays?
So what it indicates is that we've got over 4,000 active cases. What it indicates is that the virus is still growing in numbers right across metropolitan Melbourne and, as Kate's indicated, increasingly in regional Victoria. Our several thousand strong team in contact tracing and public health and support obviously have to respond on a risk-based assessment, but I don't think it indicates the system being overwhelmed. It indicates that the system clearly is under pressure. When you've got several thousand cases, that's got to be dealt with in a different way than if there's several hundred cases. We have learnt a lot over the last 20 months. We have rebuilt a state-of-the-art IT, contact and support system, but dealing with several thousand active cases is more challenging than dealing with single or double-digit numbers, and the risk-based transition reflects that.
Well, Minister, what is the health department or your modellers and telling you about the case numbers towards the end of the week? Are we going to, there's some suggestions we're plateauing, but it looks like that's not the case.
No, every indication that we've had from the people who do the epidemiological assessments is that cases will continue to rise. How far they will continue to rise, what the the reproduction factor is, that is, fortunately, by not just department but other independent experts, is coming down, but it's still well above 1. And when the ref is above 1, that means your case numbers are going up.
Sorry to interrupt, Minister. So what exactly is the ref now that we understand?
It floats around at any given point of time, but over the course of this week, it's come down from about 1.5 to about, so the advice that we've got, to about the 1.4, 1.3, and hopefully continuing to head down. But it will continue to head down by making sure that all Victorians follow the rules and make sure that you get vaccinated, because that vaccine provides that ring of protection, and that if you are having to get tested, you get tested early and quick, and you'll get the support you need. Those are the measures that will drive down those infection rates and keep us all safe.
How much do those case numbers, 400s, 500s this week, could still go up? How much of a role do they play in the roadmap, or is the emphasis much more on vaccination?
Oh, well, you won't have to wait long for the roadmap, but I know that it is a document that will drive hope, recovery, and manage our way through what is still going to be a challenging period ahead. So when we come out of that, as we will, that we have a COVID normal return to the kind of life that we also long for. And the most important, it will be an important step process to get us there. And it will be underpinned by support from the Victorian community, support for our health and hospital system, but of course based on the notion that vaccines are the pathway to achieve that.
The Premier said this week that he's expecting to hit 70% double dose. What he was told was about the 26th of October. Have you had any more recent updates on when we might hit that milestone?
So it's in all of our hands. It's also in the Commonwealth Government's hands, because they've got to get us more vaccines. But it's in all of our hands, and the more that we get tested, the more that we get vaccinated, the sooner we will get there. Every day we are exceeding what our expectations have been on our vaccination levels. We think we can do more. We know our GP partners are getting, we hope, more vaccines in October. We know that our pharmacies start ramping up, especially in the areas of the north and the west of Metro Melbourne, starting next week for Moderna. They can't get from 0 to 100 straight away. There are set-up issues as they refine their systems, but there are more opportunities to get access to vaccines across the state, prioritising in those areas that are doing it hardest at the moment. The key challenge that we have to still get to is confirmation of what the vaccines will be in October.
Given the protests yesterday by the construction workers and also the figures this morning, which reveal 73% are not fully compliant, are you going to have to shut down the construction industry?
Well, can I just say that the construction industry has had a privileged position for the past 20 months. It has been one of the few sectors that has continued operating for all sorts of perfectly legitimate reasons over that period of time. You can't say the same for any number of other sectors: childcare, retail, hospitality, the creative sector. Some people in those sectors have not worked since last year. And the relative privileged position that that sector has had comes with obligations. And to hear the very disturbing reports from the compliance blitz that basic things like no QR codes, no COVID-safe plans, no density limits being applied, the basic things that keep people safe aren't being followed, and then to overlay that with the fact that so many of the cases of permitted workers in the construction industry that have seeded from construction sites out, especially to our regions, such as Ballarat, that doubles our concern, and the public health team are having an extraordinarily close look at that, and we can't rule out taking further action against the construction sector to keep them safe, their families safe, and the Victorian community safe.
Has it come down, though, to the point where it just needs to be shut down?
We're working on the blitz, the compliance blitz, and the sector, particularly the small, independent and other parts of the sector below the big majors, they need to smarten up. But frankly, the whole sector needs to smarten up. We're working with that sector, and we want to make sure that the important contribution they make to the Victorian wider economy is protected whilst ensuring that they do it safely. And there are clearly challenges there.
Construction workers are indicating they're going to keep going with these protests on Monday of setting up in the middle of streets like Lonsdale Street. What are you going to do about that? Are you going to allow that to continue?
Well, it's not a question what I allow. It's a question of the construction industry, all sections of the construction industry, doing the right thing by their workforce, by the Victorian community. As I say, the construction sector plays an important role, but it's not a role where it gets to write its own rules. And we want to make sure that the very good engagement we've had, particularly on with employers and some of the unions in how that plays out, continues. It was unhelpful, but what we want to make sure is that the issues are worked through, and we largely believe they have, but that first and foremost, if they're going to keep working, they do so in a safe manner.
But you can understand the frustration of some when you look at the reaction to the protest today from the police and the government, and yet yesterday hundreds were on the street and there was no action against them.
Well, I think with with a bit of respect, there's a bit of difference between a smoko and a tea break effort, as unhelpful as it was, versus pre-organised, deliberately confronting Victorian police and the Victorian community to willingly break the Chief Health Officer's orders and put at risk the police who are in the city today, their families, and to delay the very thing that they are supposedly protesting against. I think there's a world of difference between that. Having said that, it was unhelpful yesterday. Having said that, we've also engaged, I think, in constructive conversations with the sector, and I hope that it isn't repeated, and that sensible measures that keep the important work that sector does happening, but in a safe way, is what happens. There is nothing safe about premeditated violent scenes that those who have organised today's efforts have in mind.
Just on that, Minister, the police efforts seem to have stopped large activity in the CBD, but there's a large group gathering in Richmond happening right now, a few hundred people with their signs, not wearing masks, that sort of thing. What's your reaction to that?
Victoria Police have all contingencies in hand, and I'm confident that the arrangements that Victoria Police and other services have always planned for as part of their response to this illegal and unhelpful gathering and the breach of the Chief Health Officer's orders gathering is well in hand.
In light of the Geelong cases, do you think restrictions could be tightened there?
Again, every day it's the public health team respond and look at not just the numbers of cases, the stories behind the cases. And as Kate indicated, the 4 cases in Geelong today, at this stage, don't appear to be linked. That's a concern. So our message is, if you are in Geelong and you've got even the slightest symptoms, whether you've been vaccinated or unvaccinated, please come forward and get tested and help us do the sort of things we need to do to identify the change of transmission so the Geelong community can stay, hopefully, in the position it is, relatively speaking, open compared to some other parts of Melbourne and Ballarat.
There's some reports suggesting that Year 12s will go back at the start of Term 4 on October the 4th, and preps will follow afterwards. I know all will be revealed tomorrow, but
that's right.
Can you give parents a little hint that there might be some...
So we want to make sure that VCE, indeed all schools, are back to face-to-face learning as soon as they can. That needs to be safe and that needs to be sustainable. The last thing we want to see is schools reopening and then closing again because of outbreaks. That's why the VCE blitz is so important. How we open and how we open sustainably and what needs to happen for that is all part of the plan that I think you'll receive tomorrow.
Can we ask Kate, if we can, just to elaborate a little bit on the contact tracing? So can you explain, will people who test positive now automatically get text messages first and then eventually you'll make contact? And when you talk about delays in making contact, how long are those delays going to be?
Yeah, look, Nick, I don't want to speculate because we don't know where case numbers will go. And as mentioned, we're always adapting to make sure we have the best and strongest response based on the volumes that we're facing with. We've scaled up and surged up, and as the Minister mentioned, we've got thousands of people working on our response. That said, it's not infinitely scalable, and no jurisdiction around the world has been able to manage with an infinitely scaled contact tracing and isolating process. So as we are using technology to our best advantage, as I mentioned, we're already sending some text messages at the moment, but if case numbers reach a certain level and that isn't, I'm not going to be able to give you a number today. It's slightly dependent on our local public health units and the different numbers that we're facing across the state. But we do expect that initial notification, some point possibly this week, towards the end of this week, into the beginning of next week, I would expect the first notification to be by text message so that people know what they need to do as soon as we have that notification. So whether there's, I think I did use the word delay in terms of phone calls before, but I think the notification and the immediate notification is the most important thing, and that's why we're going to use the systems we've put in place and our improved technology to ensure that people get that immediate notification so that they can ensure they're isolating and ensure that, their family members therefore are also isolating. Noting, of course, as soon as you go and get that test, people should be isolating. They shouldn't be moving about, but their household members may well be, and legitimately so. So getting that immediate notification of a confirmed case is really important because we know that Delta does attack through households, and it's likely that other household members of that confirmed case will end up positive.
Kate, no matter how good your technology is, if you're getting 500 a day, 500, it's over 5,000 active cases, and likely we're going to have, 500 more tomorrow. Is the contact tracing team under pressure?
Oh, the team is facing challenges. The Minister mentioned before, and we've a dozen cases a day, 20 cases a day. We're up to over 4,000 active cases. So managing that caseload requires more people and requires innovative approaches so that we can manage the public health risk, and that's what we're doing. We've been scaling and changing our response over the last 6 to 8 weeks, and as we always do throughout an outbreak. So we're continuing to do that to ensure we have the best response.
I think one of the things that you want to avoid is, like we saw in Sydney, a lot of people dying at home.
Any death is tragic, and a death at home is somewhat more so because we haven't been able to take care of that person.
So with the system is starting to grow in a bit and struggling with around 4,000 active cases or a little bit over. So does that mean the system, you've catered for that amount of 4,000 cases and it's built for that amount, and it's always going to struggle when you get beyond that?
Look, I wouldn't say always going to struggle. I think, as I say, every case is different, and the story behind the cases means a different thing. So as we've been looking in recent days, a new case in an already known household presents a different risk profile to a new case in a new area. So, for instance, we will throw more at a new case, if we had a new case in any area of regional Victoria that we weren't aware of, that's going to require, and we would give a different response to potentially a new case in Craigieburn if it occurred tomorrow. So it's really the story behind the case that makes the difference in the response also.
And you were talking about, later on you're expecting to actually have texts first and then calls. I mean, how you referred to delays. I mean, how soon can people then expect, once they get a text, a follow-up phone call? Are we talking days?
Look, it will be dependent on the circumstances, Nick. So as I mentioned, a new case in a new area of Victoria, we would be addressing much more quickly than we would, for instance, if this is the 6th household member and we've already got 5 positives in that house. You know, the messaging is different. That person would already be isolating, so the public health risk would not be as great as, like I say, a new case in a new household. So I don't want to speculate in terms of hours or time frames for between a text message and a phone call, because it's going to be case by case.
The model of setting up vaccination at testing clinics was used at Altaqua College. Are you looking at expanding that to more places, especially in the northern western suburbs, and if not, why not?
Well, at this point, we are looking at getting vaccination in places where there may be gaps, and the 100 schools that will be coming online over the next couple of months are a way of addressing that. Exposure sites themselves, of course, are a little bit different now that we are in full restrictions. Altaqua at that time, when we established that, my memory, it was within a day or two of Altaqua, the exposure being notified, and we didn't have the same sort of coverage of vaccination 6 weeks ago that we have today. Our vaccination team has done an amazing job in establishing our state hubs, keeping the doses flowing through those state hubs, but also taking vaccination to areas where it is needed most. You know, as more Commonwealth GP practices and pharmacies come online, people have access to vaccine that is closer to them, and will continue to work on those gaps. You know, and we're seeing amazing results. 16 and 17-year-olds have only been eligible for a number of weeks, and we've already got 45% of that cohort with the first dose. So we are seeing that the vaccination is available and people are coming to it, and that's the approach we'll continue to take.
With that sending out texts, will that delay things such as finding out if people are involved, say, in the construction industry, which is an important fact to know now? Will that, because you're sending out texts, will you ask people to identify if they're, say, for instance, in the construction industry or in some other high-risk group? Or how will you know that?
Yeah, we'll always be looking to identify those high-risk groups. As I said, it may be a case-by-case basis. We might already have that information if this is the last member of a household to turn positive, as an example. But if it's a new household that we weren't aware of, that would be prioritised, because the public health risk may be greater. Maybe someone in that household is in construction or is in aged care or might be working in healthcare. So yes, we will still be looking to get that information. It's always something we need to and want to know.
How are you going in those areas with compliance and, I guess, communication?
In terms of compliance of people isolating?
Of isolating, of following, essentially following the rules. People getting it.
No, in terms of, there's two different sort of elements to compliance. One with the CHO directions more broadly, but I'll speak to our household engagement program. So our household engagement program visits primary close contacts and confirm cases to make sure that they are isolating, and also to check on their wellbeing and make sure they don't need any extra support from us. We do on average 1,000, 1,100 visits a day, somewhere around there, and compliance is extremely high. The last stats that I've seen, perhaps it might have been 3 to 5% who weren't doing the right thing, and we might have needed to escalate for a second visit or escalate to Victoria Police. But overall, extremely good compliance rates. People are doing the right thing once they've been asked to isolate as a close contact or as a confirmed case.
So we have the hope of driving this down then. That's not the problem, it's just the sheer numbers that you've got at the moment in terms of getting those numbers down in those areas.
We're absolutely hopeful that all the restrictions we have in place and the things we ask of confirmed cases to do will help us stay on top of numbers. But unfortunately, where people are infectious before they become symptomatic, they may be out and about, they may be at work, they may be, you know, at Coles or on their, exercise that they're allowed to undertake. So there's that, and there is still a delay in some people coming forward for a test, which is why we do ask people to test immediately, because if we lose any of that time, it does make it even more challenging for us to manage.
Any plans for a picnic this weekend for yourself?
No.
Outdoor gatherings of any sort for yourself?
I'd love to take advantage of the relative freedoms that hard-working Victorians who have come forward and got vaccinated in record levels that have got us to 70% first jab. But my weekend will be focused on the next stages, looking after our healthcare system, looking after our healthcare workers, making sure that we drive the next vaccination levels to an even higher level, subject to the disappointing information that we got from the Commonwealth about possible delays in October vaccines. We will need to be driving all of those measures forward so as we get to 70 double dose, 80 double dose as soon as we possibly can, and get Victorians to that COVID normal that we all want to get to, whilst at the same time protecting our healthcare system and our healthcare frontline workers.
What City Council, that's the second highest number of cases, but they've got no state vaccination hub.
Which council?
Moreland, and they're calling for more support. What's your response?
Moreland are in that northern cluster, which is an area of obvious priority for the state. By the time you look at all the surrounding state hubs, as well as the other points of vaccination delivery, whether it be GPs, the clinics, the chemists that are coming on starting next week, and some of the cases that we've just announced the pop-ups today are in and around that community. So the people of Moreland, the people of the north more generally, we're always looking to what more we can do, but in terms of the 55 and growing number of state clinics, the hard ones, plus the more than 70 pop-ups, Moreland, the north and the west, rightly, are getting the majority of that attention.
Minister, tomorrow, is the roadmap finalised now, or what time do you expect the final tick of approval? And second part to my question, what time's the presser?
The latter issue is never in my hands. When the Premier's doing the media conference, it's in other hands. And of course, there's always work going on because the circumstances change. The news that National Cabinet got about delays in Pfizer allocations in October yesterday, that's had a material impact. These things happen all the time that cause us to look to how it is that we go about dealing with that aspirational positive roadmap to get us to the other side of this, whilst at the same time making sure that our health services, our health workers and people who catch COVID are all supported and protected along the way.
Do the case numbers affect the roadmap, or is it purely the vaccine?
Oh, no. It's all in the mix together. Yes, they do. It's a part of the factor that goes into the thinking about measures, but the measures will be safe, they will be achievable, and they will be in line with the National Cabinet plan.
Just on Pfizer supply for October or vaccines in general, did you not get clarity from your meeting with health ministers or National Cabinet yesterday on what's happening, or what's the latest on how it's looking for that?
Well, it's really a matter for the Commonwealth, but I think First Ministers were advised that there have been further delays with Pfizer provision in October, with more details still to be provided. But I think all states and territories received the information that we didn't want to hear, that October allocations will be less than September allocations.
Do you know by how much less?
It varies from state to state, and it was a bit unclear in that conversations with Pfizer were still ongoing.
And any updates on the Pfizer from the UK? That started arriving last week or the week before?
Yes, I believe that's in the September allocations, so I believe that's working its way into the system as we speak.
You must be pretty frustrated if there's still delays even in October, when that's the time it seemed like we were meant to have abundant supply.
Yes, is the answer. Victorians are doing an outstanding job in wanting to come forward and get vaccinated. Every week we see the numbers grow and grow and grow. We got to the 70% single dose earlier than we planned. I'd hope that with the enthusiasm that's out there, subject to supply and all the points of distribution of the vaccine being as accessible as possible to all communities, regional, remote, disadvantaged, as well as the north, the south, the east and the west of metropolitan Melbourne, that everybody gets the opportunity as soon as possible to get that jab, to do their bit to enable us to get on and implement the roadmap, which will be directly aligned to the national plan.
Is there any update on the Moderna rollout for Victoria, what that'll look like?
That starts next week. So Moderna, it'll be in a two-phased arrangement, starting, it's overwhelmingly through chemists and pharmacies. The Victorian Government is more than prepared, should it be provided to our state hubs, to have it added to our state hubs, but that's a matter for the Commonwealth. We've put up a hand and say, if you want us to be a part of that, we can do it. But at the moment, it starts in metropolitan Melbourne, particularly the north and the west, and Geelong in the coming week, and then rolls out wider through regional Victoria and metropolitan Melbourne the following week. Because it's a different system of distribution to the AstraZeneca that the pharmacies have been using up until now, it's more pharmacies with different systems. So it will take a little while for them to ramp up, but the sooner they do so, the better. And the community pharmacies are a really important part of our primary healthcare system, a very trusted part, and a very trusted part of the system for some of the community members who just might be thinking about what does this mean for them. More accessible, more trusted, and we look forward to it being an important part of the vaccine rollout. Anything else? Thanks, folks.
See you tomorrow.
Oh, well, I don't know. Will you be there? Well, I won't see you then. Ta-da.